Hello and welcome to Healthy Living, brought to you by Tammany Health System. I'm Melissa Hodgson, your host, and we're talking today about men's health, prostate cancer diagnosis and awareness, and new technology called UroNav, which helps Tammany Health System and local physicians diagnose and treat prostate cancer. We'll talk first with Dr. Joshua Sleeper, a local urologist, then with Dr. Joshua Yellen, a local radiologist, and last we'll talk with Kim Belsom, an ultrasonographer with Tammany Health System. So starting with Dr. Sleeper, good morning. Thanks for coming.
Thank you. Thank you for having me.
Very glad to have you here. So UroNav technology aside, as a urologist, can you talk a little bit about men's health and the importance of screenings and coming in annually for diagnosis?
Sure. Well, I mean, worldwide, men have a overall lower life expectancy than women. So urologic health certainly plays a role in that. In the U.S., prostate cancer, after skin cancer, is the most common cancer in men with approximately 190,000 new cases. And the second leading cause of cancer death after lung cancer with approximately 33,000 deaths per year. Screening is kind of controversial and it's gone back and forth. The U.S. has a preventative task force that makes recommendations from the role of mammograms and annual screenings versus ages and whatnot. And they've gone back and forth with for PSA screening, but now the recommendation is generally to have the patient involved in a discussion about the risks and benefits of screening, and then start screening annually or every 2 years at the age of 55, between the ages of 55 and 69, or earlier if there's a strong family history or in African American men.
Excellent. And so in your practice, you see men on a routine basis and you're screening according to best practices. And so in the case of someone who maybe has those initial screens come back, can you take us from that point?
Sure. So, we get a lot of referrals from primary care physicians who are doing the screenings for prostate cancer, which is the PSA. And so if a man comes in and the PSA is elevated, and again, that's a long discussion, what is an elevated PSA, but we discuss options, okay? So sometimes we'll repeat the test, and sometimes we feel like a biopsy is indicated, and then we discuss the role of a biopsy and proceed from there.
Okay, and biopsy specifically, certainly that's not a first level, like you're saying. That is, we've seen something, we have some concerns, let's take a look. Right. And so biopsy is an important part of your practice as a urologist, and this UroNav technology makes a little bit of a difference there. So can you talk about the product?
So the standard biopsy involves an ultrasound, a transrectal ultrasound, and we take samplings in standard areas of the prostate. So typically we take 12 cores with a needle using an ultrasound. The vast majority of men who have just an elevated PSA, the ultrasound appears normal. Mm-hmm. We don't see a identifiable region or a tumor to actually hit. And the UroNav involves overlaying an MRI image, essentially giving us a bullseye to hit on the ultrasound image. And there's been studies that have validated that it does improve detection and improves detection of higher grade cancers. And that will certainly play a role in determining treatment options for the patients. There's been a big push over the past decade to actually do what's called active surveillance in men who meet certain criteria, meaning lower risk prostate cancer based on pathology on biopsy, men who have lower PSAs, and this MRI technology is going to certainly allow us to be more comfortable and allow us to reassure men that we're making the right decision for them.
Very good. So what I hear you saying, okay, from primary care, you may see something that gets you referred to Dr. Sleeper, urologist, and then you're going to work with that patient to determine, okay, maybe what we need to do here is a biopsy. Right. And then based on that biopsy, you have this ability with the UroNav. Could we, the uninitiated, maybe think of UroNav as a bit of a GPS for you that helps you be sure you're mapping to the place in the patient's body that, in the prostate itself? Help me.
Exactly. When you do a biopsy, it's basically random samplings. Now, we do have standard areas that we target, but you're certainly not hitting the entire prostate. And then a lot of men who have larger prostates, there's no way to sample that area. We see certain lesions in certain areas of the prostate we don't routinely target, and this is what the MRI will allow us to do. My guess is, and there's also been recent recommendations from urologic associations and the radiology associations that men undergo MRIs before standard biopsy. I think that's going to probably be the future.
Okay, so right now we would go from the initial test, you mentioned the PSA, et cetera, and then the biopsy. But you see the future of this process kind of interjecting that MRI before biopsy.
Yeah, certainly.
And so that may be a place that we're going with practice.
True, yep.
Very good. Well, certainly not every hospital has UroNav, and not every urologist has the luxury, if you will, of that opportunity. We're excited to have that here on the North Shore. Can you talk a little bit about your training and how UroNav is different from what you were doing before it was available?
So it still involves the standard ultrasound guided biopsy that most urologists are familiar with, but we really rely on our radiology colleagues to assist us with this. The MRI technology, like Dr. Yellen will, I'm sure, address, is not a standard X-ray that most physicians can kind of pinpoint and look at and say, I see this spot. It really relies on a lot of technology and the radiologist's expertise to identify the areas in the prostate, and then use the technology to overlay it on our ultrasound imaging to allow us to biopsy the suspicious areas.
Excellent. So essentially what this UroNav technology is doing for you, the urologist, is giving you much more certainty and confidence about where that biopsy needs to occur in the prostate.
Exactly. It's a bullseye for us to hit.
Okay. So there's a little less uncertainty about where the biopsy needs to occur. And like you say, a bullseye, we're going to hit the target.
Exactly. You know, a lot of men, who will come in for an elevated PSA will do the standard ultrasound biopsy. We don't find any suspicious cancers or suspicious cells. But we continue to monitor them, and their PSA continues to increase, and that causes a lot of anxiety for patients, because they say, well, why is this happening? Why is my PSA increasing? And this MRI really gives us a much more confident technique to give those patients answers.
Right, some peace of mind and understanding what's happening in their body.
Right.
Because, correct me if I'm wrong, but with prostate PSA levels, sometimes we can just be in a watch and wait. Yes, the number's rising, but we're not concerned. And so for the individual man who's seeing this number keep increasing, maybe they're sort of like, well, you may not be worried, but I'm worried.
Exactly.
And so this gives a way that we can be much more accurate in the testing.
Exactly. And again, with a big push to do what's called active surveillance, meaning no treatment, no surgery for men who have low-risk prostate cancer, no radiation therapy for men who have low-risk prostate cancer. It really gives not only the patient but the physician great comfort that we're doing the right thing for these men.
Perfect. Well, Dr. Sleeper, thank you so much for coming in to talk with us.
Appreciate your time. Thank you so much.
I'm Melissa Hodgson. This is Healthy Living. And up next, we'll be talking with Dr. Joshua Yellen about the radiology perspective of the new technology, UroNav.